Can you still get hard if you have erectile dysfunction? It's a question that many ponder, and the answer is, it's possible, especially in the early stages. Erectile dysfunction doesn't immediately mean the end of all erections. Rather, it's a condition that can develop gradually, affecting the duration, strength, and frequency of erections. It's normal to have occasional difficulties getting an erection. However, if this happens more than a quarter of the time, it might be a sign of erectile dysfunction. This condition doesn't necessarily mean you can't get hard, but it does disrupt the regularity of erections. Erectile dysfunction starts with subtle changes. You may notice that you can get an erection sometimes, but not every time you want to have sex. Or perhaps your erection doesn't last long enough or isn't hard enough for satisfying sexual intercourse. Erectile dysfunction can manifest in varying degrees. Some might experience difficulty getting hard only a few times, while others may find it a more frequent issue. It's also worth noting that if the root cause of erectile dysfunction is psychological, such as stress or intimacy issues, you may still get hard, but find it challenging to maintain an erection in specific circumstances. The first symptoms of erectile dysfunction can be quite subtle. You might have difficulty getting an erection sometimes, or your erection might not last long enough for sex. In some cases, you might have trouble getting an erection at all. If you suspect you might have erectile dysfunction, it's essential to contact a doctor. Erectile dysfunction can be a symptom of an underlying condition, and it's important to identify and treat these conditions early. Doctors will examine both physical and psychological causes of erectile dysfunction and might recommend blood tests to check for hormone imbalances, cardiovascular diseases, diabetes, and kidney diseases. Leaving erectile dysfunction untreated can have consequences beyond your sex life. For instance, untreated erectile dysfunction can indicate blocked arteries and other cardiovascular conditions that need treatment to avoid complications. It can also point to nerve damage resulting from diabetes. Treating erectile dysfunction can have a positive impact on your relationships, reducing stress and anxiety. It's a personal choice how to approach treatment, but counseling is often recommended to help manage the fear and anxiety associated with the condition. In conclusion, yes, it's possible to still get hard with erectile dysfunction, especially in the early stages. However, it's crucial to recognize the signs and seek professional advice if you suspect you might have this condition. Remember, erectile dysfunction is treatable, and addressing it can improve not only your sexual health but your overall well-being.